and I heard that Staten Island is getting zero money out of the 500, well, at least 150 million. There was the first tranche of money coming to the city. So with the help of the people standing behind me, the elected officials, the borough president, the district attorney's office, and then all the providers you see behind me, we began negotiations with the mayor's office. And I'll tell you that we had quite a few Zoom meetings that really didn't go very well. But in the end, we are here today to announce that there are 8 providers standing behind me that have been awarded $375,000 a year for the next 4 years, for a total of $12 million just for Staten Island. Alrighty, good afternoon everyone. Hello to all of Staten Island. My name is Assemblyman Sam Pirozzolo, and I'm extremely happy and proud to be here today. Even though I'm only into my first term as an Assemblyman, about 18 months, this day started sometime probably in January or February of last year when I attended a TISA meeting. Where's James? When I attended a TISA meeting, and I'm sitting there with Senator Scarcella, and we're both new to the political world, if you will, to some degree, and Luke Nasta from Camelot gets up. And Luke Nasta starts saying how New York City or Staten Island is not getting any of the opioid funding that is coming from the opioid funds that were won by Attorney General. Thank you. Anyway, so I raised my hand just to say, could you repeat that once again, please? And I heard that Staten Island is getting zero money out of the 500, well, at least 150 million. There was the first tranche of money coming to the city. So with the help of the people standing behind me, the elected officials, the borough president, the district attorney's office, and then all the providers you see behind me, we began negotiations with the mayor's office. And I'll tell you that we had quite a few Zoom meetings that really didn't go very well. But in the end, we are here today to announce that there are 8 providers standing behind me that have been awarded $375,000 a year for the next 4 years, for a total of $12 million just for Staten Island. So, of course, I also have to give thanks to the mayor himself, because if it weren't for him willing to have an open ear and listen to what we were saying, this would not have happened. So let me at least let you know who's going to be getting these awards. We have Camelot of Staten Island, Community Health Action of Staten Island, Richmond University Medical Center, Staten Island Performing Provider System, Staten Island University Hospital, and the Staten Island Partnership for Community Wellness, United Activities Unlimited, and YMCA Counseling Service. And with me here today, I kind of said already, we have Senator Jessica Scarcella-Spanton, Borough President Vito Fasella, New York City Councilman and Minority Leader Joseph Borelli. We have Dan Messina, the President and CEO of Richmond University Medical Center. Megan Phillips, the Deputy Executive Director of Staten Island University Hospital. We have Dr. Joe Conti, who is also the Executive Director with Staten Island Performing Provider System. We have Jennifer Colindres, Director of Prevention at UAU. We have Erica Onaga, the Executive Director of Community Health Action of Staten Island. Jackie Phillips, the Executive Director of YMCA Counseling. And we also have Carl Green, the Chief Operating Officer of Camelot. So as you can see, this was a true island-wide effort. These providers were able to, actually thanks to Dr. Conti, gave me a list of things that they have to spend this money on, and we were able to make an undeniable case to New York City to get this money. We also have representatives from the Pulmonary Conference's office, Pulmonary Conference. We have Honolulu. We have Amelia Gonzalez, a representative from Michael Felice's office. Giuseppe Desario is a representative of City Councilman David Carr's office. Billy Matarazzo, a representative from Senator Andrew Lanza's office. And Michael Armenides, a representative of the Pennsylvania Law House. I'm very surprised that this, not so much surprised, I was determined that this would happen. I'm very grateful that this would happen. But I'd like to introduce you to some of the people who, I might be new to the scene, but there were people working on this well before I got here. One of those people was Borough President Vito Casella, so I'd like to ask him to step up and see if you'd like to do it over the two. First, I want to thank you so much for all the work to get us here, so he deserves a nice round of applause. And most importantly, this is what happens when people work together. Whether you're Democrat or Republican, doesn't matter. What's right for Staten Island and with the people behind me, and they represent hundreds of thousands of people. People aligned because it was the right thing to do. And that's what you get when you work as a team with the right goal and the right purpose. So that's what today, to me, is really about. And Sam mentioned the fact that it started before. About 3 years ago, a gentleman who works for me, a very highly respected individual, Dr. Ram Raju, who had run the New York City Health Hospitals Corporation for many years, now works for us at Go Home. He said, Staten Island is not going to get any money from this. And explained to me that the mechanism is going to go through health hospitals because we will have facilities we would get something. So we started working quietly with the administration. Basically, say that we're going to get shut out, which is not fair to Congress, especially given the history of Staten Island and local institutions. And the first salvo was, no, you'll be fine. And we just kept on pushing back, no, we're not going to be fine. It's not going to work. We need to get this done. And then along came Sam and everybody else behind us to work together and continually push to say we're not going to let up. And Sam mentioned that really was the mayor who intervened ultimately and said, fix this thing. The Attorney General played a role as well. She weighed in. So for all of the people who made this happen, thank you, Sam. Thanks for bringing us together. I'd also like to introduce Senator Jessica Scarcella-Stanton.
Good afternoon, everybody. I would like to echo what the borough president just said. This is an example of what happens when community leaders, elected officials work together. I am born and raised here on Staten Island, and people of my generation, I am on my 12th person that I have known that has tragically lost their lives due to an overdose. When I lived with Sam, I always joke with him because our job a lot of the time is to be professional, and sometimes it's a matter of just keep ringing that bell, keep beating that drum, making sure that Staten Island gets its fair share. We have so many overdose funds right now. It's devastating to see. I know it's taking down literally an entire generation of people that come here. So I want to thank Sam for coming together today. I want to thank all of the partners who do this work to make sure that people do not suffer from this disease. It's incredibly important that we got this funding. Of course, I want to thank the mayor and his team, the borough president, and the district attorney as well. This is what happens when people work together.
Hey, it's kind of hot, so I'm going through these agenda pretty quickly. So I'd like to introduce City Councilman Joseph Borelli. I'd like to tell you a really long story. I will tell you one story about a dinner with the mayor at Gracie Mansion. We were sitting at a table with the mayor, and as part of this dinner, officials go around the room and you're like giving like one moment to like state your case on some issue. So we're going around the room, and one of our colleagues who missed his own Brooklyn night was there, and he spent about 15, 20 minutes talking about the type of food that Coney Island food. And it was the most boring conversation. I don't know if you feel what type of your food for Coney Island food. I didn't. So I phoned my PEs and I shifted my carrots. He came to me, I asked the second, I had nothing good to ask for. And then it got to Sam. And Sam was forceful and decisive on this issue. He said, this is an abomination that we are not going to get a portion of this money that's going for opioid abuse. We have X number of cases, X number of deaths. Here's the statistics from Staten Island. And he made his case very effective. I think that was one of the things that really started this snowballing of getting the mayor on board and other elected officials. The fact of the matter is, you heard, we don't have an HHS hospital, HHC hospital. We also need new best friends. We get a reputation of Staten Island for being insular, closed-minded maybe, right? But that's because we have the best right here already. We don't need new best friends. We don't need new groups coming from off island to treat people with opioid addiction. We just need to make sure the groups that we have on Staten Island are well funded and well supplied to take care of the patients that we already have and the future need going forward. That's what this accomplishes. I'd like to commend Sam for being really a champion of this and the moment he got elected to the New York State Assembly. And then
I just want to give a little bit of background because it's been mentioned. So the city distributes money from the opioid fund from three ends. One of them is the City Health Hospitals Corporation, and as you know, we don't have one of those hospitals on Staten Island. The other is through the morgue, through the farm. And on Staten Island, all we really have is a small morgue over at the CB, and the third branch of government that handles it is the Department of Health, which I told does not have a very robust office here in Staten Island. So that's really what the crux of the conversation was with the mayor, was that the system that we show is that we don't get this money because it doesn't have to do stuff Staten Island, we have to come up with something else. And that's how we came up with $12 million over 4 years to go to some of our providers. So let me introduce one of those providers to you now, which is Dr. Dan Messina from Richmond University Hospital.
Good afternoon. First and foremost, a big thank you for fighting an incredible fight. It takes a village, but we need a leader too. And Sam has really been that Staten Island leader. I think we know we can talk about the stories that we all share. Loved ones, friends, family, and it's a sad story about the realities of opioid. But this fight that was recently won was an amazing step forward in applying more resources to Staten Island. For us at Richmond University Medical Center, behavioral medicine and substance abuse treatment, substance abuse treatment is really one of the things that are on top of our list. We are second in the three investments we'll be making, increased provision of pharmaceutical services, including fentanyl, vitamins, strips, and naloxone kits, and last but not least, increased community outreach, which to me is at the 50th of the top. So, again, big thank you to Pirozzolo.
Another person I'd like to introduce is Megan Sills, the Executive Director of Staten Island University.
Good afternoon, everyone. I'll keep my words short. Everyone here echoed and judgments and for all the advocacy on behalf of our I'll say this morning on my way to Princess Bay, I encountered someone in the middle of the street, please.
He was able to get all of the providers together, give me what they actually spend their money on, give me concrete dollars, programs, projects, and people, and lives that they really save. And that was the information, as I mentioned before, that we were able to bring forth to the city, which was an underlying case for Staten Island.
very typical topic. This is the book. And Sam came out and to join us. He did not stop. He did not relent. There was a lot of pressure. If you have the best, you don't need best friends. You need the people around you. And that was really important. And I think what's also really important about this is the fact that this drug crisis was a manufactured drug crisis. That the prescription providers created, seduced the clinicians in the community. That's an overprescribing opioids and medication, and has resulted in a generation that has been lost. As Senator Stanton said, a dozen people which he knows, and probably if we went around to everybody in this assembly, there would be a dozen or 10 or 20. And for Staten Island to be lost when it came to this distribution would have been unconscionable. So again, my thanks to Senator for fighting a good fight, getting the dollars to the providers that will make a difference in people's lives. Staten Island has disproportionately suffered from the opioid crisis. We were the epicenter of the number of deaths in 2015, 2016, 2017. And with the number of the electeds supporting the work that was going on in the community, the borough president, the DA, and many others, we were able to claw our way back and make a lot of inroads with the clinicians that you see present here and many others in the community. And then fentanyl. And with the poison drug supply, the way we have it now, one individual overdose can result in death. And that's why it's so important for the prevention providers who are here in the and UAUs to do their thing in the schools and the language and the treatment providers to do their thing. And the PPS is allocating more funds to the hotspotting program. It's a program that all of the providers are participating here on Staten Island, which has had amazing effects in reducing overdose, the overdose deaths. And again, thank you so much for coming here today. Sam, thank you.
And I'm not sure who else will speak, but Jennifer? Jennifer is from the Director of Community Health. I'm sorry.
One thing that we can all agree on in this continuum, right, from prevention to treatment, recovery, and harm reduction, the one thing that we can all agree on is that our kids are innocent of any of this. And UAB has been committed since 1977 to support our youth. Every young person in Staten Island has a right to a drug-free community. They have a right to grow up feeling happy, supported, informed, and that is what we are the goal of the this money is going to go for us to hire more professionals so we're going to be able to support our youngest Staten Island kids. They'll be able to come in and provide them with social and emotional learning. That doesn't happen in the vacuum. We've been doing this work for a very long time. So grateful for all the coaches and that have jumped in this work. But prior to that work, we were all part of this village called Tyson Coalition that supports us to provide resources. On behalf of Tyson, body that and this work only is possible from the work of this village behind it. Every single one of us committed to it. So thank you so much for these resources and for the heart of everybody.
this is a proud moment. A proud moment growing up in social services in Staten Island, working with those afflicted by drug addiction and their family members. I'm very proud to stand here with this contingent of leadership in Staten Island and social service providers. Chassis intends to create additional opportunities for folks who are on a path of recovery and want to give back to this industry. So our money is going to focus on workforce development, creating ladders, creating career opportunities for folks that are stable, recovered, but want to give back. And we know that that is what helps move people forward, right? That is what everyone wants to feel, that they are contributing to their stability, but to the stability of others. So we are proud that we are awarded, look forward to launching this work, our workforce development, health and stability. Thank you again for inviting me. Thank you for the opportunity to speak.
Heartfelt thank you to all the Staten Island politicians and Sam for never giving up on this fight. We want to thank the New York City Mayor's Office for continuing to push this. And Camelot looks forward to being able to utilize these funds to expand access to treatment across Staten Island. Thank you. And Giuseppe, who is representing? Okay.
I'm sorry, I feel like I'm the eighth organization. I just wanted to say a few words. Military body, the executive director. About
maybe our last speaker would be representing Senator Andrew Lanza, Billy Monroe.
Good afternoon. I'm honored to speak to you, service, and leadership cooperation. The Senator has been working on this issue feverishly for his entire tenure in the New York State Senate. It's important to note that Staten Island has an extraordinary group of elected officials. We thank Sandy for pulling this together and for working with us. The message to families that are struggling, our office is here from these families. Families' lives are being destroyed. It's not just those that are struggling with addiction. It's their relatives, it's grandma, it's brothers and sisters, and reach out for help. If you need help, we have amazing organizations here on Staten Island. We get to work with them every single day. It's actually a very humbling experience to watch people literally change the trajectory of their lives on a daily basis. So reach out for help if you're struggling. You're welcome to call any of our offices if you need an introduction to any of the providers that are here. Thank you so much for doing this. Have a good rest of the day.
And our final speaker is going to be James Castile, who was the gentleman, I believe, who organized the meeting, the breakfast that I went to, and that's what's on the whole day. You stole my phone?
Once again, the huge thank you to Sam, who took this from day one and just ran with it endlessly. But the point I said that all of the electeds who want the communities to make this happen. The only point I really want to make is that Steve said 2 years ago, I saw legislative that had to get rid of Sam and Senator Pirozzolo were there. They heard this problem at that meeting, and I emphasize to the electeds, to their staff, legislative practice, good opportunity for organizations in the state, especially struggling communities that need your attention. Sam heard that. It's not a problem. Randall, thank you for this.
Alright, so going back up, I just want to point out this one thing. So I am an assemblyman for the 63rd District, which really represents mostly the middle of Staten Island. But this opioid epidemic is not an issue that just affects the middle of Staten Island, some parts of Staten Island, some parts of New York City. It affects all of Staten Island. And I'm proud to say that I was able to reach out to colleagues, make new friends, right? So make some new friends to get this job done. It's kind of what I call the voice of one. When I was talking about this all by myself, nobody really wanted to listen. I got everybody behind me. Again, thank you to Eric Adams and Chief James, because they're the ones who also worked with us to get this to happen. And that's about it. Unless anybody has questions, we'll pick it up.